My name is Dr. Amit Kumar Chaurasia and I am the Director of TAVR and Structural Heart Disease at Eternal Heart Care Center, Jaipur. I have one of the largest experience in treating patients with aortic stenosis with transcatheter aortic valve implantation, also commonly called as TAVI or TAVR. Apart from that, I also perform other structural heart interventions at Eternal Heart Care Center, Jaipur. Aortic valve is one of the four major valves in our body. Aortic valve regulates blood from heart to the aorta, and the disease of this aortic valve is called as aortic valve stenosis. A diseased aortic valve can either leak. If it leaks, we call it as aortic regurgitation, or the area can be smaller in size and there will not be enough blood going through that area. And if this happens, then we call it as aortic stenosis. Aortic stenosis can be congenital or age-related. Age-related aortic valve disease is the most common cause of aortic stenosis. In a population-based echo study, it was found that 5 to 8% of the Indian population suffer from aortic stenosis. That is to say, around 3 lakh people require treatment for aortic valve disease. The classical complaint of patient with aortic stenosis is number 1, exertional chest pain, number 2, syncope or dizziness, number 3, exertional dyspnea secondary to heart failure. The diagnosis of aortic stenosis is done by clinical evaluation, and the confirmation of aortic stenosis is done by echocardiography. The following patients with aortic stenosis requires early treatment. 1. Patients with symptomatic aortic stenosis. 2. Patients with critical aortic stenosis, that is aortic valve area less than 0.7 cm square. 3. Patients with aortic stenosis with decreasing heart function. Surgical aortic valve replacement was the mainstay of treatment in patients with aortic stenosis previously. However, a major portion of patients with high risk were left behind and kept on medical therapy. Now we have a therapy called as transcatheter aortic valve replacement or implantation, which is approved for high risk as well as moderate risk patients. Whereas in transcatheter aortic valve implantation or replacement, the chest is not opened, the device passes through the groin and is implanted in the aortic position. The patient remains in ICU for a single day. The second day, the patient is shifted to the room. The third day, the patient can be discharged. No general anesthesia is used during transcatheter aortic valve implantation. So the recovery is faster, the mortality as well as morbidity is less, lesser chance of stroke and lesser chance of renal dysfunction, that is kidney failure. Initially, transcatheter aortic valve implantation or TAVI was approved for high-risk patient. Now it is well approved for moderate-risk patient and can also be done in selected low-risk patients.